Good morning, everyone, and a warm welcome to the first session of the three-part webinar on using systematic reviews. Yes, and I'm Ingrid van der Westhuizen, and as faculty librarian for the Medicine and Health Sciences at Stellenbosch University, it's a great pleasure for me to welcome our two presenters this morning and to introduce our first presenter, Anel Schoonees, who will be speaking to us during the first two sessions. Now, Anel is a full-time researcher at the Center for Evidence-Based Healthcare at the Faculty of Medicine at Stellenbosch University. She's a member of the Cochrane Nutrition Coordination Team, and she has a background in food science and dietetics, and she holds a master's in nutrition and clinical epidemiology. And Anel not only conducts systematic reviews, she's also involved in other research activities, including priority setting and also teaching evidence-based medicine and healthcare to undergraduate, postgraduate students, as well as to healthcare professionals and other decision makers. She's involved in translation activities, and she also promotes the uptake of evidence. Yes, and also the uptake of the evidence for systematic reviews by stakeholders. Yes, and then also with us today is Michael McCall, who's Senior Lecturer at the Division of Epidemiology and Biostatistics in the Department of Global Health, and he'll be presenting the last session this morning. And due to practicality, I'll introduce Michael further at the start of that session then. So without further ado, over to you, Anel.
Thank you, Ingrid. Maybe just before I start, can you maybe just clarify the house rules in terms of the chat? Is the chat going to be live during my talk?
Kirchner, can you maybe assist with that? I think the chat might be off, and then we might open it for a question and answer session. Is that correct?
Yes. So you will. There will be questions. They are open, and as they come through, I can publish them as they go. So questions can be asked throughout.
Okay. So will Michael attend to the chat box?
Yes, he will be.
Okay. Fine.
Yeah. Thank you, everyone.
Is that clarified?
Yes, thank you, Ingrid and everyone. I'm ready to start. Good morning, all participants, and thank you very much for joining the sessions this morning. So as you know, the first session is going to be about healthcare question types and question formulation. Okay. So just quickly an overview of what this first presentation is going to be about. We're first going to have a quick introduction about evidence-based healthcare. Then we're going to look into the different types of questions. Then we're going into formulating questions using the PICO approach. We're going to look at examples. And then at the end, we're going to look at the study designs that are matched to specific question types. The learning objectives for this session are that you should be able to describe the basics of evidence-based healthcare, identify different types of healthcare questions, formulate a healthcare question using the PICO approach, and match the appropriate study designs to the various types of questions in healthcare. In all spheres of life, there is uncertainty. The saying goes that the only things we can be sure about are paying taxes and that we're going to die someday. Now, in this challenging COVID-19 times we found ourselves in, we are very much reminded again of how much uncertainty there really is. For example, to what extent does a face mask protect us from spreading or getting COVID-19? In healthcare, even the most experienced doctor encounters uncertainty on a regular basis. To have an attitude of lifelong learning definitely helps, but how do we tackle the uncertainty? In the context of uncertainty in healthcare, we need a robust approach to systematically deal with uncertainty. Evidence-based healthcare is the approach to uncertainty in healthcare decision-making. There are various definitions of EBHC on the slide, and you can read through that later if you want, but the bottom line is really illustrated to you on the next slide. Right. The main aim of evidence-based healthcare is to improve patient or population outcomes, right? And that gets achieved by merging the three principles of evidence-based healthcare. And the one that we are most familiar with is the one at the bottom, which is the best available clinical evidence. In other words, the best research for that specific question. The other two pillars or principles are equally important, and they are the expertise from the healthcare professional or the decision maker, and also the patient or the population's values, cultures, and expectations are also very important. And when you merge these three, the aim is to have improved patient or population outcomes. So there are 5 steps of evidence-based healthcare. And on the top of the slide, you can see there's also other abbreviations such as EBP, which stands for evidence-based practice, or evidence-informed decision-making. So there are different terms which basically more or less refers to the same concept, and there are 5 A's that we use to address that with. The first one we're going to do in this session, and that is asking questions. In the session hereafter, we're going to do the searching, which is step 2, and then my colleague is going to touch a little bit on step 3 in the third session this morning. Right. But also just so that you get the bigger picture, all 5 of the A's are displayed on the slide. So after you've appraised the evidence, you also would go and apply the results of the critical appraisal where relevant into your clinical practice or decision making. And then as step 5, very important, also then look back and see and evaluate the performance of the decisions that you have made. Okay. Just to pull the circle, to close the circle off, where uncertainty and research meet. So it's very well presented on the Sense About Science document, where the link you can find at the bottom of the slide. And they say that uncertainty is normal currency in scientific research. Research goes on because we don't know everything. Researchers then have to estimate how much of the picture is known and how confident we can all be that their findings tell us what's happening or what's going to happen. And this is uncertainty. Right. This slide is also very important because it also reminds us of the bigger picture of decision making, that evidence is necessary, but on its own, evidence is not sufficient. We have to make decisions within resource constraints, within ethical considerations, cost effectiveness, and so forth. So just to keep in mind that evidence is not everything, although it's important. So how do we know what is best evidence? So it depends on the type of question, and that's what we're going to focus in the session on. Then it also depends on how well that research was conducted, which the fancy word for that is internal validity, and that also speaks to step 3 of evidence-based healthcare. And then lastly, it also depends on how applicable that research is to your question. And there the fancy word is external validity. And step 4 of evidence-based healthcare is about that. Right. So let's zoom on the types of questions. So why is it so important to identify the type of question? Well, simply because different types of questions need different study designs to answer them. For example, if we ask a question about prevalence, it doesn't help us if we conduct a RCT. We need a cross-sectional study to answer a question about prevalence. Even though RCT is a very good study design, it's not linked to a question on prevalence. And then vice versa. If we want to know what treatment works best, a cross-sectional study is not going to help us, although sometimes some people do conduct cross-sectional studies for such a question. But ideally, for a treatment question, we need a randomized controlled trial. If we just take a step back to look at what a study design is, we recap that it is a structured approach followed by researchers to answer a particular question. In other words, it's the anatomy of a study. And that determines how we sample the population of interest, how we do data collection, and how we analyze the data. So the whole design is geared towards addressing a specific type of question. Okay, so what are these different types of questions in healthcare? I'll give you a few moments to think about that. And even if your field that you are working in or studying in is not healthcare, healthcare do affects all of us at some stage in our lives. And I'm sure that you can come up with a few different types of questions in healthcare. So I'll just give you a few seconds to think about that. Okay. On this slide, I put a summary. So one of the obvious, the ones that many of you might have thought about is a treatment question, right? For example, if you have COVID-19 and you are very sick, what is the best treatment regime to help you get better? Okay. And then also in terms of preventing COVID-19 in the first place, you know, what measures can you do or can you take to reduce your risk to get COVID-19? Okay. And we can move on to screening questions. Is a screening test helpful? Moving on to diagnosis, you know, how accurate is a specific diagnostic test? Doctors also often, when someone gets diagnosed with something, they tell you your prognosis, right? Also, we often need to know the prevalence of a specific condition, right? Risk factors are important. That's a different type of question, right? And also, we don't want to do any harm. So harm is also a type of question. So on the next slide, there's a neat table that summarizes the most common types of questions in healthcare. Okay. The one that we're going to focus on today in session 1 and 2 is the intervention question. Intervention question can answer the question on treatment, what treatment works best, and also prevention, right? Let's look at formulating questions using the PICO approach, and then we'll apply some examples. So to ask a question seems simple. I mean, since we were 2 years old, we've been asking our parents and teachers so many questions, right? So why do we now need to stand still as adults to focus on question formulation? It is because question formulation helps us with 3 things. Right? It helps us to conduct research. The specific question drives the selection of what study design you're going to perform. It also forms the foundation of the protocol because it speaks to what you're going to include and exclude in your study. Right? Then secondly, it helps us to search for evidence, and that's what we're going to do in the second session in this webinar series. Right? We need to have the question to be able to formulate our search strategy. If we don't have a specific question, we're not going to recognize the answers when we find them. And also to save us time, we first formulate the question before we go on to searching strategically. And thirdly, we need good question formulation for healthcare decision making. If you don't ask a specific question, you're not going to get a specific answer, which may not be helpful. And you also can't address uncertainty if you do not ask a clear question. So broadly, there are 2 categories of questions. Background questions, where we ask basic biological questions, like what are the signs and symptoms of diabetes? Or how does COVID-19 get diagnosed, right? Foreground questions are generated in a clinical or public health or health system setting, and that is specific and relevant to decision making. And that speaks to types of questions like we had on the slide a few slides ago, where we look at treatment effects, prognosis, screening, etiology, and so on. Okay. So when we look at background questions, there are 3 essential components. There needs to be a question root, the who, what, where, when, why, and how. There needs to be a verb, And then some or other health issue, right? For example, what are the signs and symptoms of oral cancer? Or when do complications of malaria occur? The general type of background questions. Now, foreground questions is what we're going to focus on today more. And the basics of a good foreground question contains the participant or the patient or the population, or the P that we refer to in PICO. The I refers to the intervention. And sometimes when there isn't an intervention, we swap the I for an E, which stands for the exposure. Then we can refer to it as PICO, right? The C stands for the control or the comparison or the comparator. And the O, the outcome that we're going to look at, right? What do we want to achieve? Okay. Now let's look at the following question. Does aspirin improve survival after having a heart attack? Right? I'll give you a few seconds just to read through the question again. So you might think that this is a specific question, but we can make this actually even more specific. So how can we do that? Look at the following question and then compare the two. In patients with first episode acute heart attack, does daily low dose oral aspirin lead to higher survival rates as compared to placebo? I think you will all agree with me that this is definitely a more specific question. Let's look at another example. Are condoms effective for HIV? Okay. We also can make this question more specific. For example, in men who have sex with men, does regular condom use reduce the risk of HIV transmission? Right? So what elements did we add to make the previous two questions more specific? So in the aspirin example, we added who had a heart attack, in other words, the P of PICO, the dosage and the mode of the aspirin. In other words, we fleshed out the intervention, or the I of PICO, and then also we added the control, the placebo, right? In the condoms example, we added who were the users of the condoms, speaking to the P of the PICO. We provided more information in the question on the condom use, which refers to the intervention. And then also we gave more information in the second question on what we think the condoms can achieve, which refers to the outcome, or the O of PICO. Right? Here is a more comprehensive display of the tool. You can also add some other elements if that applies to your specific question. For example, the T then stands for the time frame and the S for the setting. Then you can refer to it as the PICOTs. Okay? And again, if we look at the I/the E of the PICO, I've referred to the intervention and the exposure before, but you can also have an index test if the question is the diagnostic question and how accurate is a specific diagnostic tool or test, right? The I will then stand for the index test, which is the new test that you are trying out. Okay. So on this slide, there's a summary of some of the most common types of questions in healthcare, and it helps you to use the different PICO elements to put the question in a nice language format, right? So in the specific type of participants for an intervention question, what is the effect of the intervention on the specific outcome compared with a specific control within a specific time frame? We're going to look at a few examples coming up now. Okay, here's an example of an intervention question. The P is a people or population with a high prevalence of HIV infection. The intervention is male circumcision. The control is no circumcision. And the outcome is HIV acquisition in heterosexual men. And if you use the previous slide's sentence format, if we put that together, we have a nice rounded off sentence. In populations with a high prevalence of HIV infection, what is the effects of male circumcision compared to no circumcision to reduce HIV acquisition in heterosexual men? Let's look at another intervention question example, right? Here we have the P as pregnant woman, the intervention as breastfeeding counseling. the comparison as no counseling, or you can have it less intensive breastfeeding counseling, for example, and the outcome being the proportion of exclusively breastfed babies. And there's other ways that you can state the main outcome too, right? If we use the sentence structure, we have a nicely formulated English question. In pregnant women, what is the effect of breastfeeding counseling compared to no counseling on the number of babies being exclusively breastfed for the first 6 months of their lives? So there we could have added the T element, or other words, the time element. It obviously does not relate to all questions, but when it does apply, it's useful to add. Okay. We've looked at 2 intervention questions, so let's look at the example of a risk factor question. Is snoring associated with diabetes? Right? We can make this question a bit more specific by adding more PICO elements, right? For example, are overweight adults who snore regularly at a greater risk of developing type 2 diabetes mellitus than overweight adults who do not snore, right? Here we have a diagnosis question example. Is PET an accurate test for detecting coronary disease? So we can flesh this question out a bit more by adding more PICO elements. In this case, the index test, or the new test that we are looking at, is the PET. And the question reads, is PET a more sensitive and specific test in diagnosing coronary artery disease as compared to coronary angiography? Okay? And the latter is then the comparator. Okay. The examples that we've now just looked at are all speaking to quantitative questions that will be answered by quantitative research, right? So let's look a little bit about questions for qualitative research, right? So we've looked at the PICO approach for quantitative questions, and you'll see a little bit later you can also apply the PICO format for qualitative research, but within qualitative research there are other tools as well that have been developed for the purpose of good question formulation. And the one is the spider tool, right? And I've put a research article on that for you, the citation there, if you want to go read it in your own time. So let's look at an example by applying the spider tool. Okay. So the S would stand for sample, the P and the I for phenomenon of interest, the D for the design, E for evaluation, and R for research type. Okay. If we look at the different elements, this example, the sample are women struggling to get pregnant. The phenomena of interest that are being studied is in vitro fertilization treatment. The design that the study is following is a survey or interview. And the evaluation would include looking at the experiences, attitudes, and feelings of the sample. And the research type being a qualitative or a mixed methods approach. And if we put that all together in a sentence, we are looking at what are the experiences, attitudes, feelings of women undergoing IVF treatment when they struggle to get pregnant. Okay. There's also a different tool called the SPICE, and this article that's now on the board, you can go read up a bit more about the SPICE tool. Now, from this article, I extracted this box, which gives us an example of how they apply it. So here the S stands for setting, the P for perspectives, the I stands for the phenomenon of interest, the C for comparison, and the E for evaluation. So if we look at the different elements in the community where people are at high risk, because there's close contacts, they are looking at hepatitis B and C. And the comparison, they say, is by implication only, because it's compared with those at a lower risk. And they're also looking at the knowledge, beliefs, and practices of this phenomenon in this specific community. Right. So this slide shows, which is different from the previous slide that I showed you looking at the PICOTS tool, is you will see the orange that I've added here now, right? The participants under the P, the issue under the I, and the context under the C. So if you use the PICO elements in that way, you can also apply that to qualitative questions. Okay. So let's look at the features of a good question. Right? They need to be clear, and that's why we use the PICO approach. Needs to be a relevant question. In other words, we don't just want nice to have questions. We need to know that it's a priority, you know, for a decision maker to answer that question. It needs to be a novel question. We don't want to duplicate efforts. And also it needs to be a realistic or feasible question. We don't want to be overly ambitious. Okay. So let's look at a real world scenario and then apply the PICO approach to the scenario. Okay. Many people with autism spectrum disorder, or ASD, are very sensitive to touch, including the face. Your sister has an 8-year-old boy with ASD, and getting him to wear a mask, a face mask, when going out of the house in the COVID-19 pandemic is very difficult. Your sister asks you whether wearing a face mask really can result in a large reduction of infection risk. You tell her you are unsure, but you will find out. What would be your approach to this uncertainty? Right? And from what we've learned earlier this morning is that the approach that we use in healthcare to address uncertainty is evidence-based healthcare. Okay? The next thing that we should identify from this scenario is what is the type of question, right? And if you look at this scenario, we can see that the intervention being asked about or investigated here from your sister side is wearing a face mask, right? So that shows you that this is an intervention question, right? If we go further on, we can break the scenario down in the different PICO elements, right? So the P could be adults and or children, right? Because in this scenario specifically, it's a boy that is struggling wearing the face mask, but there are many other people for various reasons who are also struggling, right? So you can decide here, and often there isn't, you know, a gold answer, right? So different people will maybe use the same scenario and formulate the question a little bit different, and that's totally fine, but we will get to the same issue that is under investigation. Okay, the I then I said is wearing a face mask. The control then would be not wearing a face mask. And the outcome that we are interested in is the risk of getting COVID-19. And we can also specify the time here, or we can call it, instead of the time that we're living in currently, which is the COVID-19 pandemic, we could have also said that actually that's the setting that this question is played in, you know, it's the setting of the COVID-19 pandemic. So whether you showed it as a T or a S, it doesn't really matter. But in this question, it's important to add this element to the question. Okay, and then if we use the structure to put the PICO question together, we can say in adults or children within the COVID-19 pandemic, what is the effect of wearing a face mask on the risk of getting COVID-19 compared to not wearing a face mask? Okay. Okay. Here on the slides, which I think will be shared with you afterwards, is a very simple table which can help you structure your questions when you encounter uncertainty. That is now when you are a healthcare worker and you encounter uncertainty, or if you're a student or postgraduate student wanting to tease out the research question for your research project. Let's look a little bit then at the study designs and how that's matched to question types. Okay. So we all know that there are various ways to classify research, and the one that I've alluded to earlier is quantitative research versus qualitative research. And I think most of all of us are familiar with these concepts. So this is just a recap slide that you can go through on your own time. But the classification that I want to get to is primary versus secondary research. Okay. Primary research is where people are included in the healthcare field now, right? And other words for that is epidemiological studies or empirical research, right? That is where people are included and they have to meet specific inclusion and exclusion criteria, or in other words, eligibility criteria, right? Secondary research, on the other hand, is where we include studies, and you can remember it by the S in secondary research and the S of studies, right? So in secondary research, such as systematic reviews, some people sometimes also refer to it as a meta-analysis, although strictly speaking, meta-analysis is really the statistical test and not the study design, right? You can have an overview of systematic reviews, you can have a scoping review, and also the one that is perhaps most familiar to everyone is the literature review or the traditional review, right? So those are the two classifications that I think is very important to know. If we look at primary research that are quantitative, we can divide them into experimental studies, right, and observational studies. Experimental studies is where there is an intervention being provided or allocated, right? And the main difference between the experimental study and the observational study is that an observational study merely observes what people are anyway doing, right? Whether as an experimental study, the researcher or the doctor or the healthcare worker deliberately assigns people to a specific intervention or control, right? And the most common experimental studies are the randomized controlled trials. Then you also get other controlled clinical trials that are not randomized. And then typically you also get before-after studies, okay? When we look at observational studies, whether there is a control group in the study or not, determine whether it's descriptive or analytical. A descriptive study don't have a control group, and examples of those are surveys or case reports or case series. When it comes to analytical studies with control groups, you have the case control study, a cohort study, as well as a cross-sectional study. And sometimes cross-sectional studies and cohort studies don't come with the control groups, and then you would have a descriptive cohort study, for example. If we look at secondary research, it is important because science is cumulative, right? Another term for secondary research is research synthesis, because in doing secondary research, we literally synthesize different research that answers this similar question together. And that allows us to evaluate the results of a given study within the existing body of evidence. And the following quote by Sir Ian Chalmers summarizes it very well, the importance of secondary research very well. He said that the results of a particular research study cannot be interpreted with any confidence unless they have been considered together with the results of other studies addressing the same or similar questions. Now, this is a very important slide because it's a summary of what is the primary study design. If you look at on the right-hand side of the blue arrows, what primary study design is best geared to answer specific types of questions, right? So if you have an intervention question, in other words, a therapy or prevention question, you need a randomized controlled trial. That is the best primary study design to answer that question, okay? When it comes to risk factor questions and etiology, we look at cohort and case control studies. Those are the best geared and the most feasible to answer that type of questions. When it comes to a question on diagnosis and the accuracy of a diagnostic test, we need a cross-sectional type of study, which also is referred to as a diagnostic test accuracy study, right? But it basically has a cross-sectional study design, right? When it comes to a screening question, the ideal design for that is also a randomized controlled trial. If we want to know about incidence and the prognosis, we need ideally an analytical prospective cohort study. If we have a question about prevalence, we need a cross-sectional study. And if we have a qualitative question about people's experiences or the meaning of something to some people, or barriers and facilitators, we need a qualitative study, right? Now, in all these cases, say, for example, you have a specific question on treatment. There would have been probably a number of randomized controlled trials conducted around the world on that question. So how are you going to decide which of the RCTs, or how many, or which ones are you going to look at in order to answer your question? So that's where research synthesis or secondary research is very important. So we shouldn't really make decisions in healthcare by looking at individual studies. We should ideally synthesize them together systematically and in a least biased way, right? And that is what a systematic review does for us, right? So a systematic review of RCTs would then be the best type of research to answer a question on therapy or prevention, right? And we can go down on the list. If we look at, for example, prevalence question, then ideally we need a systematic review of cross-sectional studies in a specific region to determine the prevalence of a specific condition, right? And we have the same for the qualitative questions on experiences and meaning, or barriers and facilitators, right? We also do get systematic reviews that included all the qualitative studies that answered the similar question. And another name for that is a QES. It stands for Qualitative Evidence Synthesis, right? That is basically a qualitative systematic review. This is my last slide for this session. And this, just in summary, shows that you get systematic reviews of different types of studies, which is matched to a specific type of question. Okay. So in this session, just to remind you, we looked at the basics of evidence-based healthcare. We looked at the principles, the main aim, and the 5 steps. Then we zoomed in on the first step of evidence-based healthcare, which is asking questions. But before we got to the PICO approach, we looked at the different types of questions we have in healthcare. Because when we ask the question using the PICO approach, we relate it to a specific type of question. And the reason why we do that is so that we know what is the best study design that is matched to that type of question. Okay. Also on my slide here, just some suggestions for resources. It includes the blog from Sense About Science, about uncertainty. It includes a very good article on the principles of evidence-based healthcare. And also the Faculty of Medicine and Health Sciences of our university, the link to the library guides. There's also a bunch of good resources there. Thank you very much. Yeah. Yes. So we will be opening the chat now. So if you have any questions, please post that in the chat. I can't see the chat on my screen, so I'm not sure. Someone must just please indicate to me if there is a question. So while we just give a few more minutes, moments for someone if they do want to post a question in the chat. So in the next session, it's going to start at 10:15. We're going to go into the second step of evidence-based healthcare, which is searching, right, for best evidence. And in the particular session, we're going to search for systematic reviews. And I'm going to do a live demonstration in PubMed, as well as in the Cochrane Library. So the presentation that I gave this morning, I gave out of the context of healthcare because that is where where I work. But I do believe that if you are from a different field, you can also take many of the principles away to your field. For example, when you're formulating the research question for your research project. Thanks, Ingrid. I think over to you. Or I don't know if I should close the session. It doesn't look like there's any questions in the chat.
Thank you, Anel. I will end the session on my side, and then we'll see those who are going to join us for the next session at 10:15. Okay.
Hi everyone, Michael here. I see there's one question on the Q&A from Chris around mixed methods designs. Is it most suitable in which cases? So Chris, that's a question slightly outside of this particular presentation and topic, but mixed method designs is typically used when you want to include both a quantitative lens in answering a research question and a qualitative lens. So mixed method designs use both of those paradigms to answer an overarching question. How it pertains to PICO is that you have a quantitative focused PICO and a qualitative focused PICO, and you'd merge those together to answer a mixed methods design question.
I see Anonymous ask a question about how many studies in a systematic review of cross-sectional studies are enough. Thank you very much. That's a very important question. And the answer relates to a systematic review of cross-sectional studies, but to any other systematic review as well, right? So typically for a quantitative systematic review, you want to include all the studies that answer that specific question, regardless of language or publication status. Okay, so in healthcare, we would do a very comprehensive literature search, which would include published sources as well as grey literature, such as conference proceedings or theses even, to pick up also studies that are not published, and also that are not specifically in English, right? Because you can have, your systematic review will have the best evidence base if you've included all the studies that answer that specific question. In a QES, in other words, in a qualitative evidence synthesis systematic review where you include qualitative studies, there is a little bit of a different approach where they do look at data saturation when it comes to the amount of qualitative studies that you do include. But in general, to answer your question, you would include all the studies that meet your eligibility criteria for your systematic review.
Anel, I see there's another anonymous question around mathematical modeling. Would you like me to answer that one? So that's also a really good question. And my response to you would be that if you are simply looking at describing the nature and landscape of a particular topic, for example, mathematical modeling on a particular area, then you are not going to be conducting a systematic review, but rather a scoping review. And the difference is something that we haven't touched on specifically, but we might address it a bit later in our sessions, is the systematic review is aimed at answering a very specific and focused question through a form of synthesis. Whereas what I think you are looking at here is mostly describing a particular body of evidence, which is the mandate of a scoping review, where we are simply doing a comprehensive search of the literature to describe the characteristics and possibly quality of studies in a particular topic area, according to predefined eligibility and inclusion criteria. Whereas a systematic review would take that further and move towards synthesis of those findings to come to a complete and comprehensive and as unbiased answer as possible. So I would read the paper by Zach Munn, M-U-N-N, around the difference between systematic reviews and scoping reviews. And maybe we can post that paper on the chat at some point later. Thank you for that question.